Hi, my name's Nico, and this is my experience of being a student nurse at a GP practice placement. The thing that I've enjoyed most is this is a type of nursing where you're very privileged in the respect that most of the time you are speaking to people who are well. You're helping manage sort of long-term conditions like diabetes or asthma, and also things like travel immunisations, delivering kind of B12 injections, sexual health screening, lots of different things. But you are seeing them in their day-to-day and helping them manage their health, which is wonderful because firstly, you get to see them as they are as a person, and you get to build relationships up with them long term. So I've only been at the practice that I'm at for 9 weeks, but I have seen people sort of on a returning basis, and that's been really lovely. As an adult nurse, you don't generally get very many opportunities to work with children, but as a GP nurse, you see people right across the life cycle, and you're nursing, you look after whole families. So you are really a kind of focal hub for that family and for the community, and I think that's really special. It's been a really great placement for interprofessional learning. So in addition to the fact that there are doctors on site, because it's a GP practice, where I've been, there are also paramedics who have been great actually. When I spent time with the paramedics, they helped me with some sort of physical assessment skills that I haven't had a lot of opportunity to do in placement elsewhere. I've also spent time with health visitors, midwives. It's been a really useful experience because you get a lot more of a sort of rounded view of the healthcare process. It's not just sort of, you don't just go there and spend time with a nurse. You spend time with everybody and you understand how the practice runs, how primary healthcare works, essentially. You do a lot of referring to the doctor or to the paramedic for additional checks. They'll do a lot of checking in with you and asking you to perhaps run an ECG on a patient that's come to them. So there's also a lot of managing medication, and checking in with sort of what the plan is for somebody long term. It's been really useful. I'd say if you have the opportunity, grab it with both hands. In terms of the skills that you do, so there's probably 5 key things that I would say broadly that you'll do in sort of practice nursing. So you'll be able to undertake venipuncture, because you do lots of blood tests. You won't be able to actually do sort of smear tests and things like that, but you'll get to experience them, and a lot of nurses sort of, as part of training won't get to do that. Immunisations and injections, you'll be able to administer B12 underneath the PSD. So as long as that's all signed off, then you can do that. Health promotion, you can absolutely get a lot out of the learning to do with that. And you're doing a lot of wound care as well. So it's not a huge breadth of skills. Oh gosh, and ECGs as well. So you might only get a chance to do a few of those in a hospital setting over your whole training. I did more in my first fortnight than I had in the rest of the sort of 2.5 years that I'd been training. So there are skills to be had. And a big part of it as well is really understanding and having the time to get to know people, to really put that, we're taught a lot about making every contact count, and taking opportunities to sort of look at health promotion, but also to sort of really engage with your patient and kind of co-produce that care. And in a GP surgery, you get that time, you get those repeat visits, and you'll get to have those role models that is their bread and butter. That's what they're doing all of the time. And you will get a lot of time to be able to observe that and take those skills into your practice.